We're on your side tonight with a health alert for the Carolinas. Cases of sexually transmitted diseases and infections have grown over the last decade. Experts with the CDC estimate that at any given time, 1 in 5 Americans is living with an infection. But according to a new study by Invigor Medical, North and South Carolina are among the top 10 states with the highest rates in the country. Even more concerning is what researchers found here in Mecklenburg County. Why don't you take a look at your screen? Those behind the study say for every 100,000 people in Mecklenburg County, at least 1,300 have an STD. The highest infection are chlamydia, with 873 people infected for every 100,000 people. There are also high numbers of gonorrhea and syphilis cases. Now, this isn't the first time we've alerted you about the rise in STDs in our area. Last year, WBTV's David Hodges tracked what was being called a syphilis tsunami. Cases were on the rise in Mecklenburg County, but specifically within newborn babies. That's because research shows young women face the highest rate of infection. This time last year, the director of Mecklenburg County Public Health, Dr. Raynard Washington, said cases of syphilis were beginning to drop, but it's still not considered uncommon in pregnant women.
So the growth is slowed a little bit, but there's still way too many. It's absolutely preventable, and we need the entire community's help and support in getting congenital syphilis under control and making sure that all of our pregnant women are getting tested and treated properly.
So why exactly is this happening? Well, this new study suggests that the Carolinas are among other southern states that are facing challenges when it comes to preventing STDs. Now, challenges like gaps in healthcare access, limited sexual health education, and various barriers to screening and treatment. But what's exactly being done to address these disparities? Last fiscal year, North Carolina received substantial federal funding to put towards prevention and control, but pressure from the Trump administration to cut budgets could further hinder the progress. Back in May, about $11 billion were cut by the federal government to assist state and local public health agencies. Thousands of jobs were also eliminated. These cuts have health experts concerned.
This was something we were on track to eliminate, a few decades ago, and then, attention moved elsewhere, funding moved elsewhere. We saw kind of an erosion of the core supports that do this work, and now here we are facing this situation.
With that in mind, health experts warn that the responsibility relies on you to get tested for STDs. The CDC suggests if you are sexually active to get tested at least once a year. If you have multiple partners, you should be getting tested every 3 to 6 months.